there is a shocking truth that limited companies and big hospitals will never tell you. The expensive health tests that you spend hundreds of dollars on every year may not actually benefit your health, but may only increase your anxiety and fear. Can you believe it? Why are tests performed with advanced medical equipment considered meaningless? Many people must be wondering, however, this is a very absurd truth that only those who have followed the medical field for many years know. If you can spare 5 minutes to watch this video, I will show you how to boldly reduce unnecessary tests and focus onto tests that are really necessary to save lives. This video will be a motivation to protect both your health and your wallet. Many of the tests that people my age do for the sake of their health are actually reducing their quality of life. In fact, some people are told that they only had one PET scan and fell into a state of severe anxiety-related depression. On the other hand, some people have only had 2 tests a year for the past few decades, and they are 90 years old and living a healthy life without taking any medication. How many tests have you had since you were 60? How many of them actually saved your life? I've had the same test every year and the results have always been normal. Are they really necessary? Just knowing the 5 surefire things I am going to tell you today. You can reduce unnecessary tests and focus on the ones that really matter. Take 3 minutes. I will give you some tips that will save you hundreds of thousands of dollars in medical costs and protect your real health. I will carefully introduce 3 tests that you do not need to do after 60 and 2 tests that you should definitely do to save your life. If you have ever wondered whether a test is really worth doing when you do it, please watch this video until the end. You will definitely see that your doubts are correct. If you find this content useful, please subscribe to our channel and give it a thumbs up. Also, please share it with your family and friends who have similar interests. Now, let's get to the main topic. First, I will introduce the PET test, which many people believe can detect cancer early. In the medical field, it is known as the cutting-edge technology and the miracle test that can find all types of cancer. However, the reality that I have seen through my 40 years of clinical experience is completely different. While online testing is expensive, it is one of the least accurate and most error-prone tests. In particular, PET testing, repeated yearly without any symptoms, is almost pointless. Why? PET scans take tiny pictures of areas in the body where cancer cells are active. The cells are more active than normal cells. It appears bright on the PET scan because it is consumed. However, the problem is that inflamed tissue is also active in the martial arts. In other words, even simple inflammation can look like cancer. An example of a long-term patient is 70 years old. He had a PET scan every year because he was worried that he might have some serious disease. The first scan found a small shadow on his right lung. He was asked to have it checked again, so he had an ear infection. During that time, he had many sleepless nights. At night, the image of his terminal lung would appear in his mind, and he would become anxious. The scan results showed that the shadow was still there. This cycle repeated many times, and he fell into a state of severe stress. Finally, 2 years later, he had a CT scan and tissue testing, and it was discovered that the shadow was just an inflammatory disease. In other words, 2 years of anxiety and pain, and millions of dollars spent on tests that were a complete waste. Through this experience, I have made a decision. I will not have PET scans again when I am asymptomatic. If you are considering PET scans because you have cancer, ask yourself first, do you have any symptoms? Is there a history of cancer in your family? Will the test results really change the direction of your treatment? PET scans are useful when cancer is suspected or when you have been diagnosed with cancer, to check for metastases or to evaluate the effectiveness of treatment. However, if you have no symptoms and you have PET scans just for peace of mind, they will only increase your anxiety and have little practical benefit. The tests are primarily tools to accurately read the body's signals, not an end in themselves. If you have PET scans every year, now may be the time to reconsider their need. Many people come to the hospital with this complaint, worried that there may be something wrong with their brain. In many cases, tests like MRI and MRAs are recommended. But are these tests really necessary for everyone? MRIs are very effective at finding structural abnormalities in the brain, to detect serious conditions like brain hemorrhages and infarctions. Although MRI and MRAs are important tests in some cases, they are not necessarily necessary for all neurological symptoms. Especially after the age of 60, natural changes in the brain due to aging increase. Therefore, testing without symptoms can only create unnecessary anxiety. So when should you have an MRI or MRAs? For example, if you have obvious neurological symptoms such as sudden severe headache, paralysis or numbness in a limb, loss of speech or loss of consciousness, you should have the test without hesitation. In addition, if you have a family history of brain disease or brain tumors, or multiple risk factors for cerebrovascular disease such as high blood pressure, diabetes or photon crystallography, then a single MRA as a baseline is effective. However, the reality is that the cost of multiple MR to treat symptoms such as simple headaches or forgetfulness and mild dizziness is very low. Instead, it is important to review your lifestyle, manage stress, and sometimes a good night's sleep and improved nutrition can make a much bigger difference. Before you go to bed tonight, ask yourself, is this symptom I'm worried about really a brain problem? Or is it a lifestyle or mental problem? Sometimes the simplest questions lead to the most essential answers. Next, we'll introduce the third and necessary test, the cardiac echo test. The heart is one of the most important organs in our body. That's why many people think it's a good idea to get regular checkups. Of course, the heart is a very important test. It can give you a real-time understanding of the structure and function of the heart, the movement of the intestines, and the state of blood circulation. However, an annual heart checkup is often meaningless when you have no symptoms. This test should be done based on symptoms. For example, when you have symptoms such as chest pain, shortness of breath, loss of pulse, and diagnostic sounds, the heart is initially used to find the cause. It is also very effective for people who have been diagnosed with a new disease to check the effectiveness of treatment and observe progress. However, if you have annual tests just to be safe, you can say that the test has become objective. I emphasize that it is important to exercise regularly, eat a balanced diet, and take your medications properly. Are we missing something by reducing testing? I understand your feelings all too well. It is natural to be concerned about reducing testing. I explain that tests are only meaningful when they are the basis for changing treatment or policy. The most important thing is to control lifestyle habits and avoid side effects from medications. Testing is a tool to determine treatment and health management, not something that will recur without symptoms. In fact, I myself was diagnosed with an aortic dissection when I was 80. Although I understood that this was a natural change due to the condition, I still felt anxious. I was retested 6 months later, but the results were the same. At that time, I believed that there was no need to test again unless my symptoms changed. Since then, I have not had any additional testing for over 5 years. Instead, I have focused on moderate exercise and diet management. And I am still healthy at 88. So when should I see a doctor? If you have symptoms such as chest pain, shortness of breath, fainting, or swelling in your legs, do not hesitate to consult a doctor and get checked out. Additionally, people with a family history of heart disease or risk factors such as diabetes, high blood pressure, and exercise are encouraged to get checked at an appropriate frequency after consulting with them. However, it is pointless to have an annual heart checkup just to be safe because you are old and feel worried. It only adds unnecessary worries and wastes medical costs. So what is the most effective way to protect your cardiovascular health? It is to listen to your body. Check your heart function yourself through regular exercise. And consult a specialist when you feel unusual symptoms. This is the most practical and economical choice. So far, we have talked about 3 unnecessary tests. From here, we will explain 2 important tests that you should definitely do after the age of 60. The first is an intracranial examination. For Japanese people, this test is not an option, but an obligation. The reason is obvious. The United States is a country with a very high incidence of gastrointestinal cancer even when compared to the rest of the world.
This is due to a complex combination of factors such as organ transplants,
high rates of Helicobacter pylori infection, and genetic factors. There are certainly at least 1 or 2 people around you who have had gastrointestinal paralysis. That's how close and serious this disease is to us. The biggest advantage of intrauterine paralysis is that it can detect both gastric cancer and early-stage cancer at an early stage. Gastric cancer is a treatable cancer with a 5-year survival rate of more than 90% if detected early. However, by the time symptoms appear, the disease is often already in an advanced stage, making treatment extremely difficult. In addition, intrauterine paralysis can detect not only cancer and other conditions by identifying and controlling these conditions early. The risk of gastrointestinal paralysis can be significantly reduced. Thank you for watching. We hope you found this information valuable and inspiring for your journey to better health. If you enjoyed the video, don't forget to give it a thumbs up, subscribe to Healthy24H, and hit the notification bell so you never miss our latest tips and insights. Stay healthy, stay informed, and we'll see you in the next video.